In the United States, breast cancer is the most common cancer of women after skin cancers, and recent data indicates that about 1 in 8 women in the US are likely to develop invasive breast cancer. That is, a breast cancer that has spread beyond the layer of the tissue in which it developed and is growing into the surrounding healthy tissues. One of these invasive breast cancers form tumors in the brain, and about 35% of them form tumors in the brain that are referred to as metastatic brain tumors. These metastatic tumors in the brain are often presented with neurological symptoms and are diagnosed by MRI or PET brain scans. Most patients have multiple deposits of tumors at the time of diagnosis, and owing to the complexity of the brain, surgery becomes an inadequate option. Numerous parallel approaches, such as stereotactic radiosurgery, whole brain radiotherapy, and chemotherapy, have been tested with no promising evidence of improvement of the patient's quality of life or the overall survival. One of the major reasons that can be attributed to the failure of numerous drugs to treat the tumors in the brain is the blood-brain barrier. And this blood-brain barrier prevents entry of a number of substances into the brain. Therefore, there is a considerable need for the development of novel tumor-specific therapies that can overcome the challenges and that impede effectiveness of current therapeutic options for breast tumors in the brain. My laboratory here at Mass General Hospital and Howard Medical School in Boston has been focused on developing successful, clinically translatable stem cell-based therapies for tumors in the brain. Over the past decade, we have tested and developed numerous tumor-specific molecules, and we are preparing to embark onto a clinical study using these therapeutic molecules for the tumors in the brain. Based on the fact that oncolytic viruses that specifically kill tumor cells, and more so the oncolytic herpes virus that has emerged as a promising candidate for high-grade brain tumor therapy, we have created a novel oncolytic herpes virus and shown its effectiveness in animal models of brain tumors. Furthermore, to make this therapy effective, in a very recent study, we've shown that if you load these oncolytic herpes viruses and their more potent variants into stem cells, you can test these in clinically translatable mouse models, and shown that the naked virus as compared to the stem cell loaded virus is more efficacious in controlling brain tumor growth. And this project is aimed to test the efficacy of stem cell loaded oncolytic viruses in a mouse model of breast to brain metastasis that we have recently developed. This mouse model is unique in a way that it allows us to track the fate of the cancer cells and also our therapeutic stem cells that are loaded with the virus. We use non-invasive imaging techniques that permit a near real-time tracking of the process going on in the animal. To better understand the process, we have divided the study into two parts. Initially, we will determine the fate of the systemically delivered stem cell loaded oncolytic viruses in mice-bearing tumors. This will allow us to ascertain that our therapeutic stem cells carrying the virus are actually tracking down all the tumor deposits, metastatic brain tumor deposits. And the next part of the study, we will test the therapeutic effectiveness of this stem cell loaded oncolytic virus approach in mouse tumor model of breast to brain metastasis. And this will allow us to determine how this therapeutic intervention affects the survival of mice bearing breast to brain metastatic tumors. I believe that the outcome of the study will lead us to the development of novel therapeutic modality in which at the time of detection of a breast to brain metastatic lesions in the patient, we will load or inject the therapeutic stem cells loaded with oncolytic viruses systemically to target these metastatic tumor cells in the brain. I firmly believe again that this will have a major impact in saving the lives of many patients that has come to this deadly type of cancer. This project is aimed at improving the quality of life and overall survival in women living with advanced breast cancers that have spread to the brain.